What are we going to?
I'll let them brief you on that because COVID-19 cases in the country hit 18,300 on Monday, the highest single-day tally since the onset of the pandemic. The health department says there could already be community transmission of the Delta COVID variant in Metro Manila and CALABARZON. PhilHealth and the health sector will be having a dialogue over its planned suspension of claims to hospitals that are under investigation over supposed fraud. Malacanang confirms that the proposed national budget for 2022 has been submitted to Congress for deliberations. And in entertainment, heads up all Red Velvet fans. K-pop stars Joy and Crush are confirmed to be dating. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Sean Yao. The health department is banking on granular lockdowns as it sees more evidence of the Delta community transmission in Metro Manila and CALABARZON. Greg Gregorio with the story.
The health department has conceded that wide-scale lockdowns are no longer the best way to contain the spread of COVID-19. Health experts believe that granular lockdowns could make more difference.
Mas magiging effective at mas magiging advantageous para po sa ating lahat kung bababaan natin ng konti pero mag-granular lockdowns tayo at i-improve po natin yung mga factors dun sa PDITR natin.
The agency reiterates that the public's cooperation is still key in the country's COVID-19 response, especially amid the threat of the Delta variant of SARS-CoV-2. Although it is not yet official, the health department is seeing evidence of the Delta variant community transmission in Metro Manila and CALABARZON. This also comes after the Philippine Genome Center said so over the weekend.
Nakita natin na wala nang link ang mga kaso sa bawat isa. We are seeing clustering of cases in these two big regions. Although we need further evidence, but there is community transmission already in these areas.
On Monday, the Philippine Genome Center tallied 466 additional cases of the highly transmissible variant, bringing the total count of known Delta cases to 1,273. 422 of these are local cases, 14 are returning overseas Filipinos or ROFs, and 10 are still unverified. The DOH reiterates the need to ramp up COVID-19 vaccination in the country while also strictly implementing COVID-19 protocols. There is also the need to shorten the time frame from case detection to isolation, according to health officials. It currently takes an average of 9 days before a positive case in the country gets isolated, while it takes 12 days in NCR. The DOH wants to trim this down to 6 days.
And we found that it took about 3 to 4 days before an individual will go and get themselves tested or consult a doctor. Pagkatapos, syempre magpapatest sila. Yung testing po, pag na-test sila maybe on the 3rd or the 4th day, aantay makalabas ang resulta, and usually the average is about 48 hours. So that's another thing. And then bago po ma-action na naman ng local governments, from the time that they receive the result, mag-contact tracing, mag-isolate, it takes about 3 days again.
The DOH projects active cases in NCR to hit 66,400 by end August and some 269,000 by end September if the previous 2-week ECQ period would be followed by 4 weeks of modified ECQ. The health department has also presented scenarios if the capital region would be placed under MECQ for 6 weeks or if a 4-week MECQ period will be followed by 2 weeks of GCQ with heightened restrictions. For SPART, Dr. Edsel Salvana of the DOH Technical Advisory Group has noted a drop in the percentage of severe and critical cases. The 2.8% cumulative percentage from August 6 has gone down to 1.8% in August 22. Salvana said this is due to the increasing number of people getting vaccinated across the country. For News 5, Greg Gregorio, we are One News.
Philippine General Hospital or PGH is still unable to accept new COVID-19 patients due to its facilities being overwhelmed. Let's find out what's happening from on the ground. Joining us via Zoom is PGH spokesperson, Dr. Jonas Del Rosario. Dr. Del Rosario, good evening. Thank you for joining us. Doc, how is the overall COVID-19 situation in the PGH? Is this really the worst you have seen since the onset of the pandemic?
It is. Thank you for having me. This is the highest number that we have. Currently, we have about 300 COVID confirmed patients admitted to PGH. So for the past 16 months, this is the highest number, much higher than the previous two surges that we had. And it occupies almost full capacity of our hospital. We initially started with 250, increased the bed capacity to 300, and so now we're 300 beds occupied, and we have to increase a little bit more. So the one limitation that we have is the manpower. Even if we open more beds or try to open more wards, we're limited by the number of healthcare workers who can take care of these patients.
Right. I guess it would be moot to ask how health workers in PGH are holding up amid this surge in cases. But you're not the only hospital to tell us that. We spoke to the Private Hospitals Association, and they're also experiencing the same problems and telling us the same things. Doc, if I may ask, why haven't we built enough capacity in the past year and a half?
We have, the thing with the PGH, we have a finite number of employees, healthcare workers, trainees, doctors. We try to fill up as many as we can for those unfilled positions. And even then, the demand is quite high. One thing about PGH, we also take care of non-COVID patients. And so this finite number, you have to allocate them both to COVID and non-COVID. And since the COVID patients are increasing, we actually have decided to basically shut down our elective non-COVID admissions so that we can redirect and assign more of our healthcare workers to the COVID. And even with that reallocation, the demand is quite high because there are really more patients coming in. And so we're forced to further cut back on the non-COVID operations to beef up our COVID operations. The other thing that also has to be factored in is sometimes our healthcare workers get sick, so they can because of the physical demands of the job, so they can get sick. Some of them will actually have COVID, and some of them will get exposed, so they also have to be on quarantine. So that also further decreases the number of available frontliners to take care of these patients.
Right, understood, Doc. Thank you for painting us a clear picture of what's going on there in hospitals right now. Now, you're talking about a lot of people getting admitted and you're seeing these highest numbers, but I want to find out, Doc, how many of these, or the quality of these infections. Do you see vaccination working in simple terms based on the numbers that you see and the recoveries maybe and the quality of infection?
Right. Okay. So we look at our numbers so far. About a week ago, we look at how many are vaccinated and how many are unvaccinated admitted to PGH. So roughly about 70% of the hospitalized patients in PGH are unvaccinated. So it's probably a reflection of the number of people who are unvaccinated in the communities. But what is more important in our data, we also saw that 70% of those who are those who are severe or critically ill, they are in the ICUs. 70% of those are unvaccinated. And about 75% of those who are intubated, meaning on mechanical ventilation, are unvaccinated. So clearly we see the sicker patients, they're unvaccinated, and most of our vaccinated patients, they are moderate to severe, and most of them will recover.
All right, that's very good to hear. Now, I want to switch just over to another topic, Doc. Based on your observations and the patients you come across, are more children and families more children really getting infected with COVID-19 through their families, I suppose, is what I'm asking.
Yeah, we are getting more, requests for admissions to PGH. According to our pediatric infectious disease specialist, They are getting more inquiries for transfers. Clearly, it's a reflection of the increase in community transmission. And just like what you said, it's usually a family affair. If the parents get infected, chances are sometimes their kids will also get infected. So it's just a reflection of what's going on with the surge. But yeah, there's a slight increase in the trend of the number of pediatric admissions in PGH. That's why we're planning to increase the number of COVID beds dedicated for kids.
Right. I guess one last question, Doc, about the Delta variant. Do you guys have a head count, or do you keep a head count of those infected with the transmissible variant there in PGH?
There was a time when we actually routinely submit our specimens to the Philippine Genome Center so that we know who among our patients actually carry the Delta. But there's so much demand from the Philippine Genome Center, so eventually we presume that almost everybody has the Delta variant. There was a time when about 21 out of the 72 samples from the Philippine Genome Center came from PGH, and it was positive for Delta. The increase in the transmissibility, and we're also seeing that a lot of younger patients are coming in. It's probably really due to the Delta variant.
All right. Thank you so much for your time and sharing all that information with us. PGH spokesperson, Dr. Jonas Del Rosario via Zoom. Thanks, Doc.
Thank you.
The Philippines has recorded its highest daily count of COVID-19 infections today. Over 18,300 fresh cases were logged, pushing the total caseload to above 1,857,000. Deaths are now at nearly 32,000, while recovery surged to more than 1,695,000. Meanwhile, over 30,389,000 doses of COVID-19 vaccines have been administered across the country. Some 13 million Filipinos have already been fully vaccinated, translating to about 17% of the target population. The Foreign Affairs Department says that 7 more Filipinos have been evacuated from war-torn Afghanistan. And this brings the total number of repatriated Filipinos to 182. 27 more are still in Afghanistan, with 17 of them requesting company or government repatriation. The rest have decided to stay in Afghanistan. Meanwhile, 5 evacuees arrived from Jakarta today and are now undergoing quarantine. Despite losing to Cuba's Yordenis Ugas in their welterweight bout over the weekend. In an Instagram post, Pacquiao thanked his fans for the support. He regretted bowing down to Ugas but said he gave it his all in the ring. The senator did not mention anything about his future boxing or political plans. Pacquiao suffered a unanimous decision loss to Ugas on Sunday, who was a last-minute replacement to the injured Errol Spence Jr. Let's take a quick look now at today's other top stories. The Budget Department submitted to Congress the proposed national budget for 2022, worth over 5 trillion pesos, the highest in Philippine history. Proposal documents were received by House Speaker Lord Alan Velasco, who will lead the legislative discussions in the lower chamber. The House Committee on Health will be holding a dialogue on Tuesday between PhilHealth and the health sector about a controversial circular. This comes on the back of one hospital group disclosing that some of its members are now planning to cut ties with the state health insurer. They said the new policy will further delay payment claims, but PhilHealth insisted that it only aims to stop unethical activities. And in entertainment, Korean news media outlets reported that K-pop girl group Red Velvet member Joy and R&B singer Crush are dating. Crush featured Joy in his song Mayday, which was released last year. They then maintained that their friendship and recently developed feelings for each other. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.